Introduction. In this lecture, we will delve into the fascinating world of cerebrovascular accidents, commonly known as strokes. Strokes are a major cause of disability and mortality worldwide, making it essential for medical professionals to have a comprehensive understanding of their etiology, diagnosis, treatment, and prevention. We will explore the neuroanatomy of the circle of Willis, the mechanisms of ischemic and hemorrhagic strokes, as well as the risk factors, signs and symptoms, imaging modalities, time-sensitive interventions, secondary prevention strategies, multidisciplinary rehabilitation, and specific considerations for stroke in young adults. By the end of this lecture, you will have a solid foundation to approach the multifaceted nature of stroke management confidently. A cerebrovascular accident, or stroke, refers to the sudden disruption of blood flow to the brain, resulting in neuronal injury and subsequent neurological deficits. Strokes can be broadly classified into two categories: ischemic and hemorrhagic. Ischemic strokes, caused by the occlusion of a blood vessel, account for the majority of stroke cases, while hemorrhagic strokes involve bleeding into the brain parenchyma or the subarachnoid space. Strokes can occur in different regions of the brain, leading to varying clinical presentations. Understanding the neuroanatomy of the circle of Willis is crucial in comprehending the underlying pathophysiology of strokes. The circle of Willis is a circular arterial network at the base of the brain, formed by the joining of the internal carotid and vertebral arteries. This anastomotic system helps in maintaining cerebral blood flow even in the presence of vascular occlusion. The circle of Willis supplies blood to the cerebral hemispheres and serves as a crucial collateral circulation pathway in stroke cases. Ischemic strokes can occur through various mechanisms, including embolic, thrombotic, or hypoperfusion related. Embolic strokes result from an embolus, mostly originating from a cardiac source, which obstructs a cerebral artery. Thrombotic strokes occur due to the formation of a thrombus within cerebral vessels. Hypoperfusion-related ischemic strokes typically arise from a systemic insult resulting in reduced cerebral blood flow. Hemorrhagic strokes, a type of cerebrovascular accident, CVA, can be classified into two main categories: intracerebral hemorrhage, ICH, and subarachnoid hemorrhage, SAH. In ICH, bleeding occurs directly into the brain parenchyma. This type of stroke is often associated with conditions such as hypertension or vascular malformations. On the other hand, SA involves bleeding into the subarachnoid space, which is the area between the brain and the surrounding membrane. The most common cause of SA is the rupture of saccular aneurysms, which are weakened blood vessels that balloon outwards. Several risk factors contribute to the development of strokes, some of which are modifiable while others are not. Modifiable risk factors include hypertension, diabetes mellitus, smoking, hyperlipidemia, obesity, sedentary lifestyle, and atrial fibrillation. Non-modifiable risk factors encompass age, gender, race, family history, and genetic predisposition. Understanding these risk factors helps in targeted prevention and management strategies. Stroke syndromes are characterized by different signs and symptoms depending on the specific region of the brain affected. One of the most notable signs is the sudden onset of focal neurological deficits, which refers to specific impairments in movement or sensation on one side of the body. These deficits may manifest as muscle weakness, hemiparesis, a loss of sensation on one side, hemisensory loss, difficulty with speech or language, aphasia, drooping of the face, facial droop, visual disturbances, or problems with coordination and balance, ataxia. Timely recognition of these characteristic symptoms is important for quick diagnosis and appropriate treatment. Imaging plays a vital role in diagnosing and determining stroke type, location, and extent of brain injury. Computed tomography, CT, scan is commonly used in the acute setting to rule out the presence of hemorrhage. Magnetic resonance imaging, MRI, is more sensitive and specific, aiding in the identification of ischemic lesions and providing valuable information for later management. In acute ischemic strokes, time is of the essence to salvage brain tissue and restore blood flow. The administration of intravenous tissue plasminogen activator, TPA, within a specific time window has proven to be beneficial. Mechanical thrombectomy, involving the removal of the clot using endovascular techniques, is rapidly evolving as a game-changing intervention. These time-sensitive approaches aim to reduce morbidity and mortality rates associated with strokes. After an initial stroke, implementing strategies for secondary prevention becomes crucial to minimize the risk of recurrence. These strategies include managing modifiable risk factors, such as blood pressure control, glycemic control, smoking cessation, lipid-lowering therapy, and anticoagulant therapy for atrial fibrillation. Lifestyle modifications and patient education also play a significant role in preventing subsequent strokes. A comprehensive stroke rehabilitation program involves a team of healthcare professionals from various disciplines, including neurologists, physiotherapists, occupational therapists, speech therapists, and psychologists. These specialists work collaboratively to address the diverse needs of stroke survivors and optimize their recovery. Rehabilitative interventions, such as physical therapy, occupational therapy, speech and language therapy, and cognitive rehabilitation, play a crucial role in improving functional abilities and enhancing the overall quality of life for individuals who have experienced a stroke. This multidisciplinary approach ensures that stroke survivors receive individualized care and support throughout their rehabilitation journey. Intracranial aneurysms and arteriovenous malformations are vascular abnormalities that can cause hemorrhagic strokes, a type of stroke where bleeding occurs in the brain. An intracranial aneurysm is a localized abnormal dilation of blood vessels in the brain, whereas arteriovenous malformations are congenital defects characterized by abnormal connections between arteries and veins. Detecting and monitoring these conditions is crucial in order to intervene promptly and prevent serious consequences associated with them. While strokes are commonly associated with older age groups, they can occur in young adults.